Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people din. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
In 2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder.
The powder.
Tinry ko din yung yung tawag dito.
Gel?
Yeah,
Soft
yung gel.
gel?
Yes.
Yeah.
It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory, salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
Napansin ng pedyan niya na maputla compared noong bagong silang kasi monthly na nagpapa-follow up kami. Maputla at saka medyo distended na yung kanyang abdomen. From then, doon kami nag-start ng workup like blood test, ultrasound, hanggang ma-CT scan and ma-work up sa hospital. Doon na na-diagnose na meron siyang stage 3 na yung kanyang tumor sa liver. When she started taking PPARs noong September 25, we decided na i-try at i-monitor siya within a month. So within a month, after 1 month, October 25, nagpa blood test and ultrasound kami. And we really thank God na there is a big improvement. For me, it's really a blessing yung PPARS because yung dating alpha fetoprotein niya na tumor marker ng liver cancer, which is 65, it went down to 14. So, almost 4 times yung kanyang binaba na from 65 to 14. At ang kanyang ultrasound din, lumiit din yung kanyang lesion. Before siya nag-take ng PPARS, it was 3.6 by 4 by 3.5 centimeters. After 1 month lang, malaki din para sa amin yung binaba niya na naging 3.1 by 2.8 by 2.7. So almost one lahat, yung 1 centimeter, yung 1 centimeter kahit 1 centimeter lang yun. Malaki na yun na pagbabago kasi 1 month pa naman eh. So aside from sa pag-decrease ng kanyang lesion, meron din kasing nakitang nodule sa kanyang spleen that measures 1.7 by 1.9 by 2 centimeters. After 1 month na sa pag-ultrasound niya, it's miracle for us because it's totally gone. It totally disappeared. So we are thankful, forever thankful for leading us to PPARS kasi we believe na ginamit ni Lord yung PPARS to help us na hindi mag-undergo ng surgery yung baby namin.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months. Cancer-free. Dapat may food supplements kayo. Like Simply Nature na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARS, sabi ni doktora, pagpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARS, ako po ay cancer-free.
Develop it at
at a young age, then it is really very aggressive. So it's really very important for you to finish your chemo. Because if you discontinue your chemotherapy, if you are less than 50 years old when you got diagnosed with breast cancer, then it's a very high chance that it will recur. There's a very high chance that you won't be able to survive in your later years.
Hi everyone, welcome to another episode of Simply Heal.
Hello everyone, hello Shan, glad to be here again. Welcome to another episode of Simply Health, and tonight we're going to be discussing all about cancer treatment, specifically chemotherapy, and why you should be able to finish it. Okay?
Doc, last week we actually talked about how to diagnose cancer, and once you confirm that you have cancer, I think the most scary thing that all patients have to go through is deciding on not to go for chemotherapy. And Doc, before we even touch upon whether you should go for chemotherapy or not, it's also very common that 30%, up to 30% of patients who actually go for chemotherapy don't finish their chemotherapy. They actually drop out. So why they drop out, we'll talk about that later. But Doc, first two questions. Number one, should we go for chemotherapy? And number two, can we drop out of chemotherapy? Is that a good strategy?
Yeah. Okay. So first, before we answer those questions, first let me show you this graph. Okay. So these researchers actually studied breast cancer patients who completed chemotherapy, those who discontinued chemotherapy, and those who did not underwent chemotherapy at all. Okay. So they studied them for years or decades. Okay, even, and they took a look at their survival, cumulative survival, their survival rate versus their disease-free survival in terms of years. So what do we mean by disease-free survival? It's the number of years where you did not have the disease, number of years in remission. Okay, so take a look at these lines. Okay,
wow.
So the purple colored line is the patients who completed their chemotherapy, at least 80% of the chemotherapy session. Okay, the green line are those patients who discontinued their chemotherapy, okay, after doing a few sessions.
That means anything less than what? 50%? Or less than 80%?
Less than 80%. Anything less than 80%. Okay, and the last one, the yellow line, is those breast cancer patients who did not go for chemotherapy at all. Okay, and take a look at the y-axis or the cumulative survival. Okay, so the highest number there is 1, which is 100%. Okay, and the lowest number here is 0, which is 0%. And take a look at the purple line. Okay, so throughout the years, okay, the number of patients who have had disease-free survival, or the number of years which they were in remission, actually is decreasing. So everything is decreasing. But if you compare the slope, okay, the steepness of the slope, okay, the steeper the slope is, okay, the poorer the survival rate.
Wow, Doc, looking at the chart over here, we actually see that by the 10-year mark, the difference between those who went for chemotherapy and completed and those who didn't go for chemotherapy is almost 100% difference. Because according to the chart here, 20% of those who went for chemotherapy didn't survive. But for those who did not go for chemotherapy, 40% of them actually died.
Yes.
So here it's quite true, conclusively, that going for chemotherapy does increase your chances of survival, especially for a cancer so common like breast cancer. Because many people have this cancer.
Exactly.
The type of chemotherapy drug gets improved a lot over the years because the doctor has a lot to practice because there are so many people. But what is interesting that I noticed over here is that when you don't complete your chemotherapy sessions, what really hurts you is later.
Yes.
It seems like there's not much difference.
Not much difference in the early years.
In the early years, but in the later years.
3 decades, 4 decades down the road, then that is where, you can actually find a drastic difference here. Okay? So especially for those who discontinued their chemotherapy, it can be dangerous.
Doc, I see that your next few charts here actually highlight, and we're flashing them through, the difference between if you would to drop out halfway? Because right now we know, the first question is answered. Should you go for chemotherapy, especially if you have a common cancer? And why? Because common cancers means that the doctors have a lot of practice in treating this. So you going for chemotherapy is going to be a better choice. Now, the next one is that, Doc, what do we say about those who go but stop halfway? I mean, what's really the thing that you want us to take?
Yeah. Okay. So there is a tendency for a worse, for a bad disease-free survival if the patients discontinued their chemotherapy when they were less than 50 years old, especially when they were young. Okay? Yeah. Because why is it so? So for breast cancer, if you develop it at a young age, then it is really very aggressive. So it's really very important for you to finish your chemo. Because if you discontinue your chemotherapy, if you are less than 50 years old when you got diagnosed with breast cancer, then it's a very high chance that it will recur. There's a very high chance that you won't be able to survive in your later years.
So,
okay?
Doc, let me get this straight, because it sounds a lot like the topic when we talk about pediatric cancer. You said that when children have cancer, their cancer is so aggressive. And it makes sense, children have to go for 20 plus chemotherapy, radiation therapy sessions when adults only go for 8 or 12. So what I hear you say just now, Doc, is that if you get cancer at a younger age, less than 50 years old, your cancer is probably going to be more aggressive than the cancer that you get when you're 60 years old. Hence, you can't really afford to let this very hyper-aggressive guy to escape. So it is imperative, or even more important, that when you get cancer at a younger age, you finish your chemotherapy, because your cancer is probably a bit more aggressive, a little bit more stronger than if your cancer had developed later in life.
Okay, so what if we take a look at different types of specific types of breast cancer? Okay, so we have what we call hormone receptor sensitive or hormone receptor positive breast cancer and a HER2 negative breast cancer. No, okay, so those who are PR positive but HER2 negative. Okay, it's very important for you to finish your chemotherapy as well, because if you discontinue it early on, then there is a huge decrease in survival rate once you hit the 5-year mark, and then after the 5-year mark. Okay?
Wow, the difference, as I can see from the chart, is actually almost 10%. And I think that's a chance that, since you already went for your 6th session, why not go for the 7th, 8th session? Finish it, right? Just 2 more sessions, you get a 10% reduction in chance of recurrence or even mortality. Doc, I mean, this really brings us to this question, right? We've settled that it's not whether you should or should not go for chemotherapy. You should, especially if it's a common cancer. Now the question is, and the question is not again whether you should you or should you not complete your chemotherapy sessions. The answer is you should. The question here is, Doc, how do we prepare ourselves so that we don't go halfway? Because for the reasons why many of us stop the chemotherapy session, obviously for all our listeners today, is because you don't feel good, right?
Exactly.
That you go for, I mean, if you go for chemotherapy and you feel fantastic, why would you stop? Why would you stop?
Exactly.
So the question tonight that we should really answer, Doc, is can you give us advice as we go for chemotherapy? What should be in our mind? Should we be thinking about, should we already have to understand we need to develop strategies to finish what we start? I think that is, how do we do that?
Okay, so I'm going to talk about, so there are different ways on how to go about it. So number one is to enhance our physical health. Okay, so we have already proven those patients who have regular physical activity, who regularly exercise, they have less side effects when they go for chemotherapy. Okay, their body, their vitality is just stronger. Another one is you have to eat correctly. So your diet is not just pivotal to your cancer treatment, it's also very important for cancer prevention. Okay, to prevent recurrence or prevent another cancer from popping up. All right, so yeah, you have to go on a whole food plant-based diet. And how can you do so? Yeah, please go for a consult so I can teach you in more detail. Okay,
Yes.
so basically those two, those are the two, you know, these two you can actually do after you watch this video already. Okay, so yeah, implement them in your lives right now.
So, but there's another one that is really important, and that's why Simply Nature works with Dr. Jansen is this. You can be healthy, you can be fit, you can eat properly, which is why you can withstand the stress of going through chemotherapy. But even if you're fit and healthy and withstand the stress of undergoing chemotherapy, it still doesn't change one important thing, that even if you don't feel it, chemotherapy might still be damaging important organs in your body, like your bone marrow, right? It doesn't mean that you are fit and you don't feel pain. It doesn't mean that the chemotherapy is not destroying bone marrow cells. And that has a big impact on your immune system, especially after the successful chemotherapy treatment. If your immune system is weak, it opens you up to a recurrence.
To recurrence, to infections, you know, anemia. You can bleed, especially when you're already on the later part of the chemotherapy protocol. Okay, so yeah, we will feel side effects. When you go for chemo, there's no way you won't be able to feel side effects. But in the off chance that you do, when you feel the side effects, it's actually very detrimental already. It's actually already affecting your daily lives. Then yeah, you can actually take Simply Nature PPARs to help you lower the side effects even further. Okay?
And that's the key thing, the key benefit of Simply Nature PPARs on the part that you can feel. Thought you were sharing a few of your patients that were bedridden, right? And that on Simply Nature extracts, they actually became energized enough to get up with assistance and walk. And Cecile actually went shopping. One of Doc's patients actually went shopping, got strong enough to go shopping. But what you may not feel, but is actually even more important, is that Simply Nature PPAR extracts protect your bone marrow from cytotoxicity. That means it prevents the confirmed side effects of common chemotherapy drugs like cisplatin and oxaliplatin. You just look up that chemotherapy drug, and one of the listed side effects is that it affects your bone marrow cells, right? So that directly affects your white blood cells and your red blood cells. And that's why when patients undergo chemotherapy, their red blood cell count may drop, white blood cell counts may drop. And if your white blood cell count, your red blood cell counts are low, your onco will be hesitant to apply chemotherapy to you for fear of making it worse.
Yes, exactly.
So that means this life-saving chemotherapy, you can't even use it because your body's not strong enough. And here, Simply Nature PPAR liquid extracts actually work to prevent that from happening. So it's one of the key strategies for you to successfully go through chemotherapy. You don't want to start, I think the thing that we learned here tonight is you don't want to start chemotherapy and not finish.
Yes, exactly.
So prepare yourself, come for a consult with Dr. Jansen so that he can help you with your lifestyle adjustments so that you will be fit and strong and you can do well through your entire chemotherapy protocols. Yes, you will feel the side effects towards the later stages of the chemotherapy. It will wear you down, but you can weather it very strongly.
Yeah, and you will be able to recover much faster.
Yeah, if you do it correctly. Don't wait until after your chemotherapy, right? It's so much harder. It's like don't enter a marathon without practicing for 6 months,
Yes.
right? You need to prepare your body to go for such a tough race. And on top of that, really get yourself on the Simply Nature extract protocol because that will protect your bone marrow, your spleen. These are critical organs for your immune system. It will prevent recurrence. And for those who are going for immunotherapy after your chemotherapy, this will protect your immune system so that your immunotherapy will work even better. So yeah, that's why we need to finish our protocols the moment we start them. And I can see Doc, a lot of questions coming already. I hope nobody's gonna ask us if they're gonna have to take chemotherapy or not. Alright, but feel free, if you still are uncertain, you're hesitant, you're worried about taking chemotherapy, just ask. We are fine. We are happy, Doc, to answer that question again and again. And you never know, in your situation, Dr. Jansen's advice might be for you to avoid chemotherapy. And I can already think of one case. If you have prostate cancer, stage 1, stage 2.
Yeah, you won't actually need chemo for very early stage prostate cancer.
All right. So tonight is not. We are not for chemotherapy. What we are for is effective treatment for your cancer. So we will give you advice accordingly based on your cancer type. So without further ado, let's go to our AMA segment. Cancer program, I think, in Southeast Asia. I don't know. Maybe the world. I have no idea. We've been here every Thursday for the past 2 years, answering your questions and teaching and sharing with you about cancer.
All right. Sir, can everybody please comment down if you can hear us now? All right. Can you say yes if you can hear us?
All right. Yeah. Okay. Okay. Huh? Okay. Let's go.
Okay, there you go. Oh, thank you. Or thank you, Miss Nessie, for commenting. Or of course, not only that there are a lot of questions coming in, but I can see a lot of new viewers tonight as well. Thank you for watching us and sharing our webinar to your friends and co-patients in your hospitals. Okay, all right. So for the first question that we have here tonight, coming from Ms. Lloyd's. If a person is diagnosed with ovarian cyst, how much is the possibility of developing into ovarian cancer?
Okay. Ovarian cysts have different types as well. Okay, so we need a specific diagnosis because there are subtypes of ovarian cysts. Now, there are certain types of ovarian cysts which can become cancer. Okay, but there are some which stays benign just stays benign. Okay. However, what you need to be more worried about is if the ovarian cyst is increasing in size, because there are certain types of ovarian cysts which can enlarge really huge. Okay, enormous in size. So I've had one patient before, when I was still a student, who had an ovarian cyst. Now, this person came in the OR seeming like a pregnant lady in the 3rd trimester. So you can just imagine how big her tummy is. Now, after the surgery, we were able to get 36 centimeter, no, it's not 36 36 inches. Okay, 36 inches.
Wow.
It's a huge mass. Okay, it's like a basketball. Okay, so if you have an ovarian cyst, you have to monitor the size. Okay, but if it is still small, then better to have it removed. Okay, if it's already causing problems. Okay, so how will you know what to do? Follow up frequently with your OB. Okay.
Yeah, I think prior to starting our program 2 years ago, I was also very concerned about surgery. Then you know, this past 2 years, learned so much about surgery because we work with oncological surgeons like Dr. Jimmy, and he was explaining how the procedures are done today. They are a lot less invasive than we imagine. So even a lung surgery only has like a 3 centimeter cut. That's really very small. 3 centimeters is so small, and that's a surgery done on your lungs for lung cancer. So yeah, don't be afraid. Go and do find out more information before you scare yourself. All right. So everything is good. Everything is improved now. Yeah.
Very encouraging answers. Thank you, Doc. Thank you, Sir Sean. All right. For our next question, coming from Ms. Lilibet Palma. Before I read her question, I just want to greet her happy birthday because it's her birthday tomorrow. Our avid viewer, Ms. Lilibet Palma from the Philippines.
Oh, wow!
Happy birthday!
Happy birthday!
Birthday. All right. So for her question, okay, how can PPARs help people who have cancer, especially those who are having chemotherapy and radiation therapy? She's a very helpful viewer.
I'll handle the help cancer part. You
Okay.
handle the chemotherapy
Okay.
part. All right. Okay. So how does Simply Nature PPARs help with cancer? Number one, it really boosts your immune system, and it's not just a general statement of boosting your immune system. We actually are catalysts for the pathway that that modulates your immune response. It also helps you modulate your inflammation in your body. So in all, there are like 5 ways PPARs actually helps you attack the cancer. It gets your own body's immune system to attack the cancer more strongly. It helps the body detect cancer cells. One of the important things about cancer is that the normal immune system can't detect the cancer. So it's like a cloaking device, right? So what Simply Nature PPAR does is help the dendritic cells, which are responsible for identifying invasions or cells that are not normal, like cancer cells, and flag them. So basically, it's like in the army, you have someone with a laser pointer pointing at the target so that the cruise missiles, which are your immune systems like your NK cells, your T cells, can go and attack the cancer. Next, we make the environment very difficult for cancer because PPAR helps to regulate all your metabolic syndromes. It also manages your chronic inflammation. So cancer thrives when your body is inflamed, right? Because when your body is inflamed, it also is very easy for blood vessels to form. And if blood vessels are formed, then cancer cells, cancer tumors grow very quickly. So these are some of the basic ideas or the basic method of actions how Simply Nature PPAR will help you combat cancer naturally. All right, combat cancer naturally. Doc, how about chemotherapy?
Yeah, okay. So let me give you an example, okay, on how PPARs can help. Now, there are, for cancer, no, we have solid tumors and we have blood malignancies or those like leukemia. Okay. Now, first, let's talk about solid tumors. Okay. Now, of course, we know that solid tumors can spread. Now, it can metastasize. Now, the reason why oncos are recommending chemotherapy is to, number one, kill the cancer cells. Okay, shrink the tumor and kill off the microscopic cancer cells that are circulating around your body. Okay, that is the purpose. Now, of course, we know that aside from killing the cancer cells, the healthy cells or the normal cells can be killed off as well in the process by the chemo. Okay, specifically, okay, the bone marrow. All right. Now, why am I talking about the bone marrow? Okay, because one of the very common side effects of chemotherapy is it has bone marrow toxicity. Now, when the bone marrow is damaged, okay, your blood cells, your red blood cells, your white blood cells, and platelets will also go down. Okay, because why? Why do they go down? It's because red blood cells, white blood cells, and platelets mature from the bone marrow. Okay, the bone marrow is sort of like their nursery. Okay, so now when you go for the chemo, of course, the bone marrow will experience toxicity. It will get damaged. Okay, now there will come a point that your body might not be able to recover sufficiently fast enough to receive the next cycle. Okay, because
for various reasons, especially when you are more advanced in years or if you are already elderly. Okay. Now, PPARs can help the bone marrow. Number one, PPARs can help protect the bone marrow and reduce bone marrow toxicity. That's number one. Number two, PPARs, since it's a gene activator, it activates the body's capacity to heal itself. Okay, that is what we call cellular differentiation. Cellular differentiation is the medical term or the scientific term of cells maturing. Okay? Now, remember, chemotherapy destroys the bone marrow cells. Now, PPARs can help the healthy cells recover. Okay? And aside from that, it protects the bone marrow so that the toxicity, the damage gets reduced. Okay? So that is how PPARs can help. Now, this is very good for solid tumors. How about if the bone marrow is the problem itself?
In leukemia.
Yes, in leukemia.
I think one of our viewers, his son has actually leukemia.
Yes. Yeah. Actually, the reason why I'm sharing this to you guys right now is because I just saw a leukemia patient a while ago. Okay. Now, I was explaining to the patient that although yes, we know that PPARs can help protect the bone marrow, the integrity of the bone marrow. Okay. But however, what if the bone marrow itself is the problem? Okay, it produces abnormal cells like leukemia. In leukemia, my patient a while ago has CLL or chronic lymphocytic leukemia. Okay, the person has malfunctioning lymphocytes. Okay, so how do we go about this? Okay, will PPARs be counterintuitive? Will
it do the reverse?
Yeah, will it do the reverse? Because it now protects the bone marrow, and we want to destroy the lymphocyte cells. Now, the beauty here is that if you combine PPARs with, let's say, chemotherapy or the mainstay treatments, okay, like chemotherapy, immunotherapy, targeted therapy, okay, especially for leukemia, especially targeted therapy, because targeted therapy only destroys the abnormal leukemia cells. Okay. Now for the rest, PPARs can help your body fix the error. Okay. Okay. So now, if you combine those two, you reduce the number of abnormal cells, and you help your body produce the healthy cells or the normal lymphocyte cells. Okay, that is how PPARs can help both patients, a patient with solid tumor receiving chemotherapy and a patient with blood malignancy like leukemia receiving chemotherapy or other treatment modalities. Okay.
Doc, I mean, to add to your example, lupus patients. We have lupus patients, right? Once they take, for example, chronic lupus from teenage years, we have one patient, she took it for 3 months and she's now fine. Her lupus symptoms are gone, and even her, what's that called? She had all those ovarian, I think, myomas because of lupus. All right, PCOS, sorry, PCOS, okay. Right? Lupus is your own immune system attacking
your body.
Yes. So if you take a product protocol like Simply Nature PPARs, which is supposed to strengthen your immune system, you'd be worried, right? Because
yes, exactly.
Your own immune system is going crazy. Are you going to make it super now and it becomes super crazy? But in our lupus patients, what happens is like what Dr. Jansen shared. The body does have a self-correcting mechanism. There is a correct pattern, and PPARs is able to help the body fix the problem. That means to actually reproduce cells correctly, right? And because of that, it can help you. You know, Doc, I was just remembering a conversation I had almost, oh my God, 30 years ago. Oh no! 30 years ago. Yeah, in college, right? In college. And I remember my RA, which is a resident advisor, so he's the person in charge of the resident floor. He's also a student. He's a med student, and he took orthopedics.
Yeah.
Because he said he didn't want to deal with sick patients. Mm-hmm. Because when you deal with bone, it's usually sports injuries, right? Yes. Yeah. But he was just sharing with me that he said, Shen, the human being is the most tumor-resistant animal in creation. That's true, Doc?
That's true.
That's true, right?
That's true.
Yeah, so I was thinking about it. We can live to 120. It's not because we have a low metabolic rate like a tortoise or turtle. We have very high metabolic rates, right? But we have an incredible self-correcting, tumor-killing immune system.
Yes.
But it's not working because of lifestyle. So this is why actually human beings can live a long time. We don't die from tumors like mice, hamsters. Anybody who has hamsters as pets, they usually die from tumors. And as your dogs and cats grow old also. But they don't live as long as us because their body is not so anti-cancer. So Doc, they teach that in med school, that the human being is the most resilient?
Yes. Well, our professors did not say that specific term, right? But just learning on how the body works, or how the human body works, especially the DNA, on how it corrects itself, it's really amazing. So if you live healthily, there's no way you will develop cancer. Okay, there's no way. However, if in the case sooner later in life, well, this is for if you don't have any family history of cancer, or there's no family history, there's no hereditary factor in your family that cancer gets passed on, then once you develop cancer, now it's acquired, right? It's really your fault. I'm sorry to say, but yeah, it's really your lifestyle in the environment in which you are living in. So yeah, it's really your fault if you develop cancer. So now that's why I'm very adamant, especially when I talk to my patients, avoid all the carcinogens, okay? Avoid all cancer-promoting foods, avoid all cancer-promoting products that you are using, especially if you are fond of, if you have vices, smoking, alcohol drinking, so these things, So
It's Doc, I mean, it's quite frightening, it's quite alarming to all our viewers out there. I'm not sure if you know the cancer rate in Britain. Was this study just for UK, Britain? All right. If you were born after 1960, okay, that means I'm born in 1974, so I fall in the category. As long as you're born after 1960, your chance of having cancer is 50%. That is frighteningly high, right? You have a 1 in 2 chance of being a cancer patient. That's obviously it's got to do with our lifestyle.
Yes.
But Doc, I see a very important question right now from Mr. Gonzalez, J.A. Gonzalez. Yes, he said that I want to ask how PPARs will be a great help with my treatment since I just finished 4 cycles of immunotherapy with chemo as my first protocols. I'll talk a little and you fill in the gap. Number 1, immunotherapy works with your own immune system. Okay, so depending on the type of immunotherapy, but in general, immunotherapy doesn't fight on your body's behalf. What the immunotherapy does is very similar to the COVID vaccine. It trains your body to be able to target the cancer cells correctly. Okay, so what that means is that if your immune system is generally very weak, let's say you have low white blood cell count, low red blood cell count, your immunotherapy's effect will actually be lower. All right, and the fact that we have to use chemotherapy first because you have to weaken the tumor, weaken the cancer cells, then it's like giving the cancer cells a strong punch so that to stun the cancer cells or to make them stumble, so that it's easier for your body to fight with the help of immunotherapy. It's a double-edged sword, right? Because chemotherapy can really punch hard, but chemotherapy can also damage your bone marrow, and your bone marrow is like the factory, the nursery of your immune system. So if your factory and your immune system is weakened, then when you do immunotherapy, it's less effective. So this is where PPAR really comes in. It protects your bone marrow, your factory for your immune system, while the chemotherapy is hitting the tumors, right? Hitting your cancer cells. and it protects your immune system, so that when it's the turn for the immunotherapy, your immune system is actually strong, and when the immunotherapy helps your body identify the cancer, you have enough soldiers, and these soldiers are strong and fit, and so your immunotherapy will be more effective. Doc, your turn.
Yeah. So I just want to add to what Shan said. No, another benefit of immunotherapy is, cancer cells mutate as well.
Yes.
Okay?
Yes.
That's why they can evade your immune system. Okay, so they can live. So normally we have cancer cells circulating around our body. The reason why it doesn't form a tumor is because our own immune system are already killing the cancer cells on the get-go. Now, why does it develop into a tumor? It's because the immune system cannot detect the cancer cell anymore. So the cancer has a mask, okay, in such a way that your immune system detects the mass as a normal. It's a normal being. It's a normal thing. Okay, so that's why it doesn't kill it off. One of the functions of immunotherapy as well is to remove that mask.
Oh, to unmask the cancer.
Now, if the cancer's mask has already been removed, now the your immune system can now recognize that, okay, this is the bad guy. I have to shoot you down. Okay, so that's another benefit. Okay, now here's another angle, another mechanism of PPARs. If you combine PPARs with immunotherapy, or combine PPARs with chemotherapy for that matter, it works hand in hand. It works synergistically. There are certain immunotherapy drugs and chemotherapeutic drugs which can enhance the effect of PPAR agonists. And also likewise, there are the PPAR agonists themselves can enhance the effect of the chemotherapy and the immunotherapy. Okay, that's why I always tell my patients that it is best taken together with your chemotherapeutic drugs and your immunotherapy drugs. Okay, why did I say this? Because here's an example. I'm going to go a little bit more technical here, so please bear with me. I'll explain this in very simple terms as much as I can. Okay. Now, inside our body, we have our PPAR receptors. Okay. Now, if you take PPARs like simplynature PPAR, so simplynature PPARs are PPAR agonists. This means that simplynature PPARs can attach to the PPAR receptors to stimulate the PPAR receptor inside your body, okay, to enact its effect. However, what if you just have very low PPAR receptors inside your body? Now that would be a problem, okay, because just taking PPAR agonists alone will not work as much. Okay. Now you have to combine it with a chemotherapy drug because a chemotherapy drug, specifically capecitabine, increases your PPAR increases your PPAR receptors inside your body. Okay, it has that effect. Now, if you increase your PPAR receptor inside your body, then taking the PPAR agonist will now be very effective. So this is one of the ways how it works hand in hand. It works really well together. Okay, that's why I always tell my patients, please take them together. Don't just rely on the natural treatment. Don't just rely on the natural protocol. You have to consider other treatment modalities because it will give you the best chance. Okay.
Yes. I also wanted to add that, apart from the actual immune system that we always focus on because we are fighting cancer, don't forget, you got cancer because you probably have high blood sugar, high blood cholesterol. It is right now absolutely accepted and proven that metabolic syndromes like high blood pressure, high blood cholesterol, high blood sugar is the precursor to cancer. That means if you have diabetic today, and if this and your diabetes, your blood cholesterol continue to worsen, you are on a confirmed straight line path to cancer like in 20 years, something like that. All right. So these metabolic syndromes are the foundations of cancer. So when you're fighting cancer, we also got to understand that it would be ideal if you can also remove all these foundations for cancer. You know, lower inflammation, remove your high blood cholesterol, remove your hypertension, lower your blood sugar. These are very important. Just to give you a simple example, most cancer patients are constipated. You know, it feels really terrible. I don't know if you, I'm sure that if you can remember the last time if you had a fever or something like that, and when you could go to the CR and when you pooped out, you felt better. I mean, it's really strange. You have fever, so why has poop got to do with the heat? Well, you have toxins stuck in your body, and then your body's inflamed. You know, if you can clear it out, it definitely helps the body recover. So as a cancer patient, your body is doing lots and lots of fighting. So there's lots of unwanted chemicals or dead bodies. You know, when you go to war, whether you are the victorious side or the winning side or the losing side, there are dead soldiers on the battlefield, and you need to clear it out. If you don't clear it out, it complicates the battlefield. It makes infections rampant, right? So this is something that I think as cancer patients, you got to really take note. Don't just focus on the immune system. You got to focus on whether your kidneys, your livers are healthy and functioning. Because when the moment your liver gets into trouble, almost all the drugs cannot be used anymore. So imagine if your liver is damaged and then you have a complication, even if you had pneumonia. Imagine I knew a cancer patient that was doing very well. She caught pneumonia.
Yeah.
And she died from pneumonia. She didn't die from the cancer. She died from pneumonia. So it's almost like for cancer patients, do remember your body is undergoing a tremendous battle. You got to make sure all the other sicknesses and organs are healthy. This is why Simply Nature PPRs and why lifestyle medicine, why adjusting your lifestyle is so powerful. It's so powerful because when you eat healthy, not are you only anti-cancer, you also promote good bowel movement. You feel stronger so you can walk and go outside. When you go outside, you get vitamin D naturally. So all these things really, really add up, and it makes your quality of life very good, and it increases your chances of winning your fight against cancer so much more. So to Mr. Gonzalez, definitely. But I would advise you, Mr. Gonzalez, to go for a consult with Dr. Jansen so that you can share with him the exact immunotherapy drugs that you're using, so that he is aware as well to make sure that everything is done right and proper.
Oh, by the way, talking about how to consult, the link where you can schedule to get a schedule for a consultation with Dr. Jansen is actually indicated in the description box and also pinned on the comment section. Okay, by the way, just before we read or go into our next question, please type in where you are watching us from. We want to know what occasions, all right, our watchers are coming from tonight, okay? We are also live streaming on YouTube. Yes, and just want to greet our viewers there because we also have a question coming in from one of our YouTube viewers coming from Kid P. Hi, my dad was diagnosed with stage 3 colorectal cancer, 75 now, obstructed. Now he is currently taking PPARs for 1 week. Since my dad does not want surgery and colostomy, just now we added chemo drugs. Is it okay?
Yes, definitely. However, I want to ask, what type of PPAR protocol are you taking? Is it powder, is it liquid, is it soft gel, or is it tablets? Because for colorectal cancer, I would advise you to go for the liquid. The liquid is the best. It's the best for colorectal cancer. Okay, because just imagine, the tumor is inside your colon, right? Now, if you're going to take in liquid, you are going to drink it. Now that PPAR's liquid will bathe the tumor itself, so that would be more powerful. Okay, so yeah, and if you are
and also the liquid is extremely effective in energizing the patient. Yeah, you know, if you ever take Actually, this is quite interesting. I actually have a congressman. I know a congressman and his wife. During election period, they took the pipa liquid as Red Bull. It's very expensive Red Bull, but the comment that they made was that they could do in 4 days what they usually can't even do in 2 weeks. So they had so much energy. So why is that important? Is because your dad is 75. So I think as a son, I'm sure one of the things you hope to do with your dad, and I can empathize with you, is you would, if you could, you would like to maybe take him out for a long walk one more time, perhaps go for a short trip to somewhere he likes, maybe go and visit an alma mater. Like for me, when my dad had cancer scare, especially the second time, I told myself I'll bring him back to Cornell. Because my dad graduated from Cornell, which is it's a top university, it's Ivy League in the US, and it's his glory days. Yeah, right? So I thought it would be really nice if I could bring my dad, if he was strong, to bring him overseas to US. So for that viewer who was talking about his 75-year-old dad, I'm sure one of the things you would like to do is to do more things with your dad. Not only cancer patients, many years ago in Cebu, we had a client whose dad was 90 plus. He was just dying of general organ failure. He's just old. His organs were just failing. He was just old. So what happened was that he smuggled, because his dad was in ICU. So he smuggled the liquid in, and he used a dropper, and he gave the dad gained in strength, and the doctor thought that it was his care, right? But my client knew that it was not. It was really the liquid PPARs, all right? And we had another doctor who had a patient who was overseas in Hong Kong, severe, had cancer, and it was a very serious condition, such that he was so weak that the hospital refused to let him go, because they were worried if they let him go and he died, it might be a legal issue. So what happened again, they actually couriered the liquid PPAR all the way overseas, and after 1 week the patient was strong enough to fly back to Philippines. Okay, so one of the common effects that we do notice with the liquid PPARs is usually within 72 hours, bedridden patients will be able to sit up. I have one patient, again, this one was in a hospice, all right? She had brain tumors, brain cancer. So she spent 6 million pesos in the hospital. And after all the treatment, the doctors finally said there was nothing more they could do for her. So she was pretty much like in a state of coma. She couldn't talk. She was very weak. She was in a hospice, really Catholic hospice, basically waiting to pass on, because her brother was a priest, and her older sister who paid for all the younger sister who paid for all the medical bills was a nurse from UK. So she flew all the way back just to spend time with her ate one more time, right? And what happened was that we tried liquid PPARs on her, and lo and behold, so shocking, right, that in about a week, she was sitting up and lively having a conversation, and I got to see her. I got to talk to her. It was like she was like a recovering patient, right? So she's gonna get well. Unfortunately for her, 2 weeks later, she did go, but she was not in a coma. She was fully awake. She had many long conversations into the night with her sister who visited her from UK. So we're not even just talking about the anti-cancer effect. I'm just gonna say that the liquid PPARs is really effective or powerful in giving the patient strength. And I think for this particular viewer, 75 years old is not a bad age, and your dad doesn't want surgery. So I think what he probably wants is to spend quality time with his loved ones, which is you, right? So we will lift him in prayer. His life is in God's hands, but we can do a lot to make sure that the time he has is energetic, and maybe, who knows, we can even reverse, because it's only stage 3 colorectal cancer. There is a good chance, But all in all, at the very least, make sure that your dad is strong. You can talk to him. He's clear of mind. He can maybe eat. I don't know if we're gonna allow him to eat his favorite food or not. Yeah, so we always talk about eating healthy, but at certain age, what you want is also for the person to be happy. It's subjective, all right. This is a call that you have to make as children, and of course the patient himself. So I hope this helps. This helps you keep everything in perspective and what to look out for. Okay.
Yeah.
Thank you, sir.
Why not go for a consult? So
go for
I
a
can,
consult.
Guide you because I have to know more. I need to know more details on where you are on where you guys are right now. What are the treatments that have been done? Just basically to know you so that I can make the proper recommendations that fits you.
Yeah.
Okay.
Yeah.
Yes, thank you, Sir Sean. That was very encouraging. I couldn't agree more. Just very quick, I am sure you can remember Miss Shirley who shared his her dad who had 72 years old. Just before finishing the box of vials, right? We had a very good conversation with.
Oh, really?
And it's actually the kids and relatives who are saying thank you to us for that one.
Wow. Okay, that was very good. I remember Miss Shirley. Yes.
All right. Okay. Another question coming from Ms. Marites de Samero. Good evening po. I want to ask about B17 amygdalin from apricot kernel extract. Is it safe to shrink tumor as natural treatment for cancer patients?
Okay.
I've come across this many times.
Many times.
There are a lot of research, both pro and
anti.
Okay.
Yeah. Here's the thing, no. Yes, there are a lot of research in the literature or studies in the literature that shows that amygdalin can really kill cancer cells, and it's true. It can kill cancer cells. Okay, it can shrink the tumor. However, there are also studies that have been shown that those patients who took amygdalin died. Okay, seemingly good patients, healthy patients, took amygdalin and they died. Okay, that's the thing. Now, where do I stand with B17? Well, I have better options within my arsenal, so I would not recommend it for my patient. The only time that I would recommend B17 is the time when there are already no other options left. Okay, if you are terminally ill, then that's the only time that I would consider B17 or taking amygdalin. Okay, but if you are on your early stage cancer, like stage 0, stage 1, stage 2, I would consider other treatment protocols first, which are safer, okay, and which has a better safety profile. Okay. Another thing, amygdalin is banned from the market. Okay.
Oh yeah, it's illegal.
Yes, it's illegal.
In Philippines, it's illegal.
It's illegal in a lot of countries. Okay, so
why?
Yeah, it's because it kills.
Oh wow. Okay.
That's the main reason. Now, there are a lot of conspiracy theories that the big pharma is blocking it. That's why it's banned. However, what if it's not? Okay, what if it's not? So, first tenet in medicine:
do no harm.
Do no harm. Okay. So, if there are better options, then go for the better options first. Okay. And then, another thing, it's really very difficult to procure. Since it's very difficult to procure, it's only bought from the black market.
Oh, that's dangerous.
So there are no
regulatory
body that regulates it. That's the thing. Okay, so I hope you understand.
It's a good question.
Yeah, that's a good question. I think, Doc, in this question, you actually brought out a concept. Thank you very much, the viewer. I don't know how to pronounce your name. Marites, yeah. Thank you very much, Marites. I think what Marites brought to the table tonight is this. When we fight a death-threatening disease like cancer, we really go all out and research, and we really want to try all sorts of things, right? All sorts of things, because it's life and death. But as we approach the different cures or treatments that are available as you go out and explore, I think it's important to understand that yes, there are treatments that are effective, but they carry a lot of risk. I'm going to share with you my personal example. It's not cancer, but I hope by giving you this example, you understand what I'm trying to say. When I was young, when I was about 9 years old, I sprained both ankles repeatedly, many times in a very short period. So what happened was that from 9 to 12 years old, 2-3 years, as long as I stand more than 10 minutes, my ankles hurt. So that's just not good, right? And I'm such a young boy at that time. Well, I have an uncle who's a genius. He's like a Hua Tuo. Those of you, Lily will know who Hua Tuo is, right? He's like a miracle worker. He's a neurosurgeon and he does cancer research. He climbs mountains to pick herbs. He's an incredible acupuncturist. Anyway, I visited him in Hong Kong. My mom told him about my ankle. So he went to his back room and he came back with a syringe this long. Glass syringe. Wow. That's how like archaic it is. Glass syringe. And there was white liquid in there. He injected it straight into my ankles. Okay, it was mildly painful, but it freaked me out. You know, people inject into your ankle joint. All right, that's just scary for a boy. He didn't ask me for permission. He didn't tell me anything. He just injected. All right. After that, on the first night he injected one ankle. The next night he injected the other. I want to tell you something. Almost instantaneously. That means the ankle that he injected, of course, we massage it because he injected so much liquid into the thing. You know, massage it for about half an hour. That night, immediately I could walk and I didn't have pain. The next day he injected the other ankle, right? And I said, wow, I'm healed. It's like miraculous healing. It's not like, 2-3 days of no, it was like almost instantaneous. I'm healed, and from that day onwards until now, I'm 49 years old now. My ankles had never given me problems. But this is what my uncle said to me before I went back to Singapore, right? He was in Hong Kong. He said, don't sprain your ankle so badly again. He said, because the medicine that I gave you, we can't do it again. And anyway, he said, if I had injected wrongly, you would have been lame. Lame. I would have been crippled. I said, why didn't you tell me that before you injected the thing?
So okay? it was like all or nothing.
So I'm just sharing that, as a cancer patient, sometimes we got to assess properly. Your condition may not be so serious that you have to take such an extreme bet, right? There are many options that do work, and maybe some of them work even better than these options that we are looking at. So usually if something is, and this illegal part, Doc, is something very worrisome because, for example, we are microalgae, right? Mm-hmm. So some microalgae, some companies, some people think natural is good. So there are some algae brands like spirulina. I've seen algae brands that their whole claim is that they are so natural, it's harvested naturally. But as a consumer, you got to understand, you don't want to take algae harvested naturally because they are toxic. Okay, it's like you don't go and eat mushrooms in the wild forest. Exactly. Okay, you get poison. All right, so there are people who take these algae and then they end up, their blood turns green. That's literally infestation. So again, you really want to make sure things are regulated. And that's my 2 cents. I do know of doctors who do prescribe B17 in Philippines. Don't ask me about it, okay, because it's not legal. But it has some of it has good results. Or else they won't be prescribing it. Yes. But I'm just again trying to say, why don't you, Maritas? Why don't you go have a consult with Doc Jansen, okay, and check to make maybe there are protocols, things that you can do without taking any risk. Right, so I'm sure B17 could be effective for some cancer patients, for some specific types of cancer, but it might be a Hail Mary. I'm not sure if the term is familiar in Philippines. that means it's a long shot. It has its downside also. So why not go for safer protocols first? And if all things fail, then you can always still do your Hail Mary tries, right?
Exactly.
We're not saying don't take it, but why don't you try the better, safer protocols that are effective? And if those work, then you don't have to take that risk.
Agree.
Right?
Yes.
And if it's not enough and you want to take B17 after trying everything, I think that makes more sense. You've already tried the safe ones and you have no other options. You want to go for something which could be toxic, but at the same time could work, right? Yeah.
Thank you, sir. Thank you, Doc Jansen. Okay, right, another question. By the way, just before we go to the next question, I've asked where are our viewers coming from and watching from. Some are watching from, of course, nearby BGC. Some are watching from Malolos, Bulacan. Hello, Bulacan. Kalumpit, Bulacan as well. And San Jose del Monte. Hello. A lot of Bulacanes here. Watching from Parañaque. Good evening po. And there you go. Thank you for watching us tonight. Okay, for the next question that we have here, coming from Ms. Myra La Peña, can I take PPARs while taking tamoxifen?
Yes, it works well together. Okay, tamoxifen is a hormone therapy for breast cancer, and PPAR agonists have been shown that it enhances the killing effect of tamoxifen. Okay, it's also true for its counterpart letrozole. So tamoxifen and letrozole both. PPAR agonist enhances letrozole and tamoxifen's capacity to kill cancer cells.
Doc Jansen, I just want to, on behalf of our viewers, I just want to thank you so much. Because I'm sure all the viewers, you are, I don't know, I think you are, this is a very strange experience for, I think, a lot of viewers, right? Because normally when you try a natural supplement, like when you try Lingzi, for example, or ginseng, or some direct marketing companies, grapeseed extract or whatever, right? Seldom can you ask the person, how does this supplement match up with my specific drug, tamoxifen?
Have any interaction?
Most of the time, nobody can answer your question, right? Whether this supplement has any effect with this chemotherapy drug I'm taking or immunotherapy drug you're taking. But here tonight, with Dr. Jansen is able to really state it so clearly because we understand how the chemotherapy drug works, how the immunotherapy drug works, and how the protocols that we recommend here, how they work together, and that they are safe for you. And we make it in a way that everyone can understand. So I think it's so important when you're treating yourself, you understand what's being done to your own body, right? So that you can have responsibility over the outcome. Yeah. Thank you. Thank you, Dr. Jansen. No, I think it's very comforting. Normally when we go for natural, they only talk natural. But they they say take your turmeric, but they won't say how turmeric interacts with tamoxifen or whatever. So normally, as a recipient, as a patient, we don't get to see the two worlds come together.
Yeah, before when I was still a novice doctor, I always get to see patients who are exactly this same concept, I am taking the supplement. Is this supplement okay? My doctor asked me to stop taking this supplement because it's like this and like this and like that. So here I am. I mean, these are supplements, right? And you cannot deny the fact that there are patients who improve from taking supplements. So I studied it further. I went further into details on how it works, how it really works, which supplements are bogus, which supplements are
real,
not really reliable, and which are real, which has a real effect. Okay, and then you can see the trend and where it goes. Okay, so going back to the apricot question a while ago, the supplements which tends to be bogus or doesn't have really a consistent effect are those who isolated certain nutrients from the fruit, from the whole fruit. So it's like turmeric. Turmeric is the root, right? Yellow ginger. Yeah. Right, turmeric. Now the active compound of turmeric is curcumin. So if you isolate curcumin and use curcumin alone, then it can produce certain toxic effects. Okay, it's similar to carrots. Carrots has what?
Beta carotene.
Okay, beta carotene. Beta carotene, even when you further
Extract it.
you can have vitamin A. Or if you further process beta carotene, you can have vitamin A. Now, if you're a smoker, you should not be taking vitamin A supplements because that can increase your risk for developing lung cancer. Okay, so what can we learn from this? Also, for amygdalin. So apricot is the fruit. If you want to have the benefits of amygdalin, then eat apricot. Okay, eat the whole fruit. Okay. Now, amygdalin is the active compound of the apricot. So it came from the kernel, apricot seed. Okay, if you can extract amygdalin from the apricot seed. Okay. Now, what did I tell you a while ago? There are certain studies which proves that it really works to kill in killing cancer cells. However, it also kills you. Okay, so that's the thing. So usually, supplements which are reliable or with consistent effects are those supplements which are whole foods. Okay, so like your microalgae. Microalgae, not just Simply Nature pea bars.
Yeah, like your chlorellas,
your
spirulinas,
your malunggay capsules. Okay, powdered malunggay, garlic powder. So, and these powdered spices are readily available in your supermarket. So usually, if it is a whole food, if it is still in a whole food form or moderately processed, powderized. Okay. Usually these are the food supplements which has still beneficial effects. Okay, so please keep this in mind. Okay, when you're buying your supplements.
Yeah, correct. And even for those who are staunch, for example, supporters of traditional medicine, like ginseng, if you check the Chinese almanac, which is our equivalent of your in Western medicine, what do you have? You have a catalog of drugs, right? What's that called?
That is the.
What do you call that catalog?
Miss Jen would know.
Jen would know.
Jen, what's the book that the drug reference book?
And MIMS.
Yeah.
But MIMS is the company's name.
Okay, it's synonymous with
drug.
Well,
dictionary.
The traditional Chinese medicine also has an almanac or a book, like an encyclopedia for Chinese herbs. Do you know that it's written in there very clearly that if you eat ginseng every day, you will get ginseng toxicity? I mean, you will actually get poisoned, right? So there are many strains of ginseng, but you're not supposed to eat ginseng every day. So even though it's good for you, if you take too much, it's actually toxic. So again, this is where supplementation, why doctors in general are hesitant about it, because they don't study much into it, but they do know that if you're not careful with your dosage, there could be some things that some side effects. All right. What has no side effects or less side effects are like whole foods. Yes. If you eat too much carrots, you will turn orange. You literally will turn orange. But that's about it. You stop eating, you turn back normal color, right? You eat too many bananas and papayas, yes, you will get LBM. But if you stop eating it, your body just go back to normal. So this is the reason why certain supplements or natural approaches are safer than others. You know, the Chinese, when we have our Chinese prescription, in Chinese we actually say 以毒攻毒, which means use poison to fight poison. Alright, so Chinese herbs are natural, but they are actually poisonous. So the more effective a formula is, a prescription is, it has its downsides also. In fact, because I'm going to go into TCM. So anyway, this is interesting to me, and maybe for everybody else is something a little bit off topic but interesting. You know, when you look at a Chinese prescription, they will throw a cockroach in, a bug, and all these things, right?
Yeah, why do they do that?
Yeah, okay, why do they do that? Because let's say if there are 10 ingredients, 3 or 4 are the ones that are for your illness. The other 6 is to balance the 4. That means the 4 that is being prescribed to you to fight your illness is powerful and toxic as well. So they add 6 other herbs to balance it out. I think that's something worth thinking about, right? That the thing that they use to treat you is effective, somewhat like chemotherapy, but it has its downsides. So you actually have to balance it out, because if you don't, your body will be pushed into imbalance and you might suffer from toxicity. All right, so just a simple thing. I was taking celery.
Yeah.
I'm drinking raw
How
celery.
was it?
Very good, right?
Very good.
I was at my acupuncturist. She said, "Oh, celery is good, but do add ginger."
Yeah.
Because celery, from the Chinese nutritional perspective, is liang, is yin. All right. So if you take too much of it, it will actually weaken your body.
Oh.
So you take a bit of heat, which is ginger,
Ginger.
and it counteracts it so that you can have the benefits of celery without its negative side.
Oh.
So it's a bit like, you go for chemotherapy, you take PPAR, so you counteract the...
Oh, it's quite interesting.
Yeah, it's quite interesting. So
You added ginger?
Yeah, I added ginger.
How did it
Oh,
taste?
it tastes much better because I don't like celery, right? So the ginger added a bit of oomph to it, and I added some lemon to that too. So that's very interesting, This concept is found in chemotherapy as well, because chemotherapy is a cocktail. It's not one chemotherapy drug, it's multiple chemotherapy drugs, right? So I think as we really delve into the thing, what I think is really beneficial and enjoyable, and so thankful for Dr. Jansen, is that having conversations like this help us understand actually the same principles, right? So Chinese medicine, they've 8, 10, 12 different types of herbs. Only 3 or 4 are for your sickness. The other 8 other herbs is to balance this 4.
Wow. Okay.
All right. Yeah. So
Makes sense.
makes sense.
Because in Western medicine, how us doctors treat patients, we prescribe a drug, right?
Oh, and it has
It
side effects. Then you
Now
take
we have
another drug to balance.
Oh,
Yes.
True.
It's the same principle.
It's the same principle, right? So it's the same principle. So whoever said natural is safer, it's not true. As long as you're using herbs, there is always toxicity. Now, if you're just using food, then we can say it's safe. But
Now, everyone, now that you know this, don't just take natural supplements on your own. You have to consult with a professional, okay? Because with learning what Shan had said, right? These natural supplements or these herbs also has side effects. It's like drugs as well.
yeah, they're just natural drugs.
So don't just don't just self-medicate, okay? Go for a professional consultation.
Anyway, to our viewers, if you check the dictionary, I checked it a long time ago, but who knows, they may have changed the definition a little bit. But if it's man-made, it's called poison. If it's natural, it's called toxic. Okay, so toxicity and poison is something is toxic because it's naturally occurring. Something is poisonous because it's processed. All right, but they both do your body harm. All right, so doesn't mean natural is safe. All right, so I hope tonight this little digression. Hopefully next year, because next year I'm gonna start my next further studies in proper. After that, we have really interesting conversations with Dr. Jansen, right? I'll come with a TCM approach, right? And we'll probably see many insights on how actually medicine is all encompassing. The perspectives might be very, very similar. Yeah. I hope our audience is finding this interesting. Just a little break from normal cancer talk. Yeah.
I am learning tonight a lot. I'm learning a lot, and I'm
Yes,
sure
I know.
also
For you, Sheila, you are cannabis advocacy, right?
Yes, cannabis.
I just had a conversation with my brother. I was so shocked that my brother was saying that Singapore should probably honestly take a look at weed or cannabis.
Yep.
Because it does have its medicinal effects. I told him it's the high is the high that makes it the hallucinogenic effect, which
THC,
makes
yeah.
yes, that makes it that makes government worried, because in Asia we had our stint with opium.
Uh-huh.
All right, many people got addicted to opium, and it destroyed a generation of men because they ended up in the opium dens, just dazed all the time. So it's not. I think the government is worried about that effect, and
Yes.
not the medicinal, and not really questioning the medicinal effect, right? Yeah. So these are
So
very
there's
interesting.
synergistic effect as well.
Yeah. Correct. Yeah. Okay. Let's go back to cancer.
Yes. Thank you so much. Thank you, Dr. Jansen, and thank you, Sir Fan. Next question coming from Ms. Charlie Cruz. Doc, for patients with multiple myoma and breast cysts, what can you recommend?
Okay, first of all, I would recommend that you go for a consult, okay? Number one. Because I need to know the size of the myoma, how many are there, how long have you been having that. I need to know your age as well. For your breast cyst, how big is it? The ultrasound findings, the mammography findings. I need more information, okay? If you're just asking for a PPAR protocol for myoma and breast cyst, I would be focusing more on the myoma and not the breast cyst. Okay, for the myoma, I would suggest either soft gel or PPAR's powder, depending on the size and how many it is, and depending on what your symptoms are. Okay, how bad is it? Or is it a very mild? Is it an incidental finding? Are you not feeling anything? So these things have to come into. I would have to factor in these things. So please go for a consult.
Yes, and for and for newer viewers who do not know, we co-hosting this program. We also decided to work together, Doc Jansen's practice and Simply Nature. So we did a really great deal where basically your consult is complimentary if you're going to both have the consult and use Simply Nature products. So just indicate that you're interested in a consult. Sheila and Beth will let you know more.
Yes, please. Once again, there's a link where you can schedule for a consult with Dr. Jansen Calalan. Okay. Okay. So for the next question that we have here, it's coming from Ms. Lily Lu. Lily Lu, Dr. Jansen, I want to reconfirm that stress activate my BRCA genes resulting to breast cancer. Is this right? Is DNA also part of cancer causing? Already done 6 cycles of chemo to shrink the tumor and lymph node flatten. Now on Herceptin and tamoxifen.
Okay, BRCA activation has a lot of factors, no? So number one is if you know that your ancestors, so your parents, your grandparents, your aunties, one of them developed breast cancer before you, then you know that the BRCA gene that you have inherited from them. So it's not really something that you did that triggered it. It was already there in the first place. Now, what you need to do is turn it off. Okay? So, you live healthily, you live...
manage stress.
Manage stress, these things. Now, can stress trigger or activate BRCA gene? Not 100%. Okay? It's both yes and no. Yes, stress can activate the BRCA gene because if you are stressed most of the time, then the free radicals inside your body will be so high. So the free radicals are the ones that damages the DNA. Now, if your DNA is always bombarded with free radicals, naturally the DNA will self-repair itself. The more frequent it self-repairs, then the more chances that an error can occur. Now, the corrector, okay, the DNA repair mechanism itself can also get damaged by the free radicals. Now, if that gets damaged, the DNA repair mechanism, then you'll have cancer. Okay?
So that is one aspect of a yes on how stress can on how stress can activate the BRCA gene. Okay, so another one is if you are stressed out, you will eat what? Unhealthy foods. Okay, we human beings were designed to be such. Okay, we evolved that way. It's a behavioral thing. So we have to be very mindful on the foods that we pick. Okay, because the foods that we pick, if they are quite unhealthy, then the foods can activate the BRCA gene. Okay, so that is an indirect way of stress activating the BRCA gene. So that's the reason why it is both a yes and a no. Okay.
Doc, I'm gonna come from a viewer. After hearing what Doc said, my answer, my interpretation is yes. Stress will activate your your cancer because it makes your body the free radicals, which makes your body unstable, and then if you're like any normal person, you will also behaviorally start to do things to de-stress, and those things are most likely unhealthy.
Yes.
And
Now, if you are someone who have no family history of breast cancer, and suddenly you found out that you have this BRCA gene activated, no, you're positive for the mutation in BRCA gene, then that would be the case. Okay, it's something that you're probably stressed, you're probably eating not right, then that can happen. Okay, but if you have like Miss Lily, no, with our consult, you told me that you have really a very strong family history of cancer. Then with that, it will not be entirely your fault.
Yeah.
Okay.
Yeah. And I heard in her comments over the many months she's been with us that she had a very stressful life also.
Yes.
Yeah, probably occupation related.
Probably you were like a CEO or like when you were working or rah.
Yeah.
Yeah, well, all of us are working to feed our family.
And that I know because I used to work at Merrill Lynch, and very stressful because we are brokerage investment house. We had like 4 or 5 leukemia patients in the entire office. That's just abnormal, right? It's just abnormal. Yeah. All right.
It's quite really frustrating because in places where stress is really, really high, it is where you can also find foods that are not healthy.
Unhealthy.
Yes.
Exactly.
Yes.
Yeah, I remember I was working on a night shift, and it is where the midnight
snacks.
Foods are available.
Yeah, and only the terrible food is available at night, right? Yeah.
All carcinogenic, yes.
Yeah.
All right, coming from Ms. Betchay Leonardo. Hi, I'm stage 3A breast cancer, ER and PR positive, HER2, NEU negative. How many cycles of chemo do I have to undergo? Thanks.
Okay, it really depends on how advanced is the breast cancer, no, and how big the tumor is. But typically, doctors prescribe around 6 to 8 cycles of chemo. Okay, around 6 to 8 cycles. Sometimes up to 10. Depends. Okay.
But don't worry, we have said it many times. We explain the mechanism and how specifically our protocols help to protect you from the side effects of chemotherapy. We just talked about Chinese medicine just now. How you do 8 of the 12 herbs is to balance out the 4 ones that they are working. So and then it makes that whole prescription safe.
Yep.
But if you only took the 4 herbs, it's risky because it's toxic. But you balance it out with the other 8, the whole prescription becomes a miraculous prescription. So when you pair up chemotherapy with support, make sure that you live the right lifestyle so that you can come through the chemotherapy with as little side effects as possible, and together with PPARs to keep your bone marrows protected and your red blood cell, white blood cell count up. All right, so I think then you don't really have to worry about chemo. Doc, I want to confess, maybe about 5-6 years ago, I actually told myself that if I ever got cancer, because we kept looking at the statistics being in the industry, right? I said if I'm past 60 years old, I'll just go natural. That means if I make it, I make it. If I don't, I don't.
Yep.
But today, I changed my mind. And I think it's important to change our mind. Why else would we gain more knowledge, right? We gain more knowledge so that we make better choices. Right now, after first of all seeing how our product helps patients, I'm no longer afraid of chemotherapy myself. And now I know, because I own, I'm part of Simply Nature. I can drink not one liquid vial. I can drink 3 liquid vial a day. I have plenty of stocks in the. I can just go and get it from the factory floor, right? So yeah, my approach is different. If ever I got cancer, I hope that doesn't happen. I will not be afraid of chemotherapy. I won't say I won't do it anymore. But honestly, 6 years ago, very hesitant, like many of our viewers. But with the information and seeing the results, and both the research and the actual results from our patients and clients, yeah, I'm very confident. So I hope for Beth Chai, all right, that I hope my confession also encourages you, all right, and strengthens, give you confidence not to be afraid, all right.
It's your time. Thank you, Dr. Jansen.
But I just want to add,
Sure.
I want to share with Miss Beth Chai that one of our patients experienced.
Oh, okay.
Yeah. So this patient of mine, I saw her first stage 4 breast cancer. No, I saw her. She's already quite weak, bedridden, in pain, so much in pain. Only had 1 cycle of chemotherapy. Then came to me because they are opting for natural therapy already. So when I interviewed them, when I assessed her, I saw that she can still go for the chemotherapy, and she's quite young. Okay, so I told them to go back to their onco and to continue the chemotherapy. However, before I told them, before they go back to their onco, I would need to strengthen her body first. So that was the time I told them to change your diet, only plant-based foods, take PPAR agonists already. I prescribed them liquid, 1 vial a day. Okay, they did it for at least 1 month. Then they went back to their onco already. So when they went back, the onco put her on chemotherapy. Now the onco initially prescribed her with 8 cycles. Okay, she was already finished with 1. However, she was not able to continue it. That's why the onco had to reset the protocol. So her onco prescribed 8 cycles. On the 2nd, 3rd, and 4th cycle, this patient of mine already gained weight. With already was able to cook. She was able to go up, rise up from her bed, go to the restroom on her own. Her pain was significantly reduced already. Okay, that was just on the 4th cycle. Now, the onco told her, okay, let's finish up to 6 cycles. So, the patient finished 6 cycles. On the 6th cycle, her onco assessed her again. There are a lot of tumors that we were able to palpate before, which now are gone.
Wow.
So the onco decided, okay, since you already responded well, we can now opt for an alternative treatment already. So onco decided to stop the chemotherapy. Okay, on the 6th cycle. It was supposed to be 8. Okay,
Yeah.
so upon changing the protocol, then the patient initially was on oral chemo first. Then after the oral chemo, she was shifted to hormone therapy already. Then targeted therapy eventually. Okay, so this is how oncos decide depending on your response to chemotherapy. So initially they may prescribe a huge number of chemotherapy. They later on reduce it. Okay, depending on your response. Okay.
So to all our viewers out there tonight, if you are a cancer patient, I would strongly encourage you to get a consult, because Dr. Jansen and his team are wonderful. They actually will walk with you on the journey. They're not going to just meet you once or twice or over 6 months like your onco. They will actually check up with you every week. As Miss Lily finally experienced, right? I heard that her consult with you was 45 minutes. You will not get 45 minutes with your onco. You are usually out of there by 10 minutes, right? Yeah, so this is the thing. I think cancer is something, it's a long journey. It's great if you could have someone to talk to understand what's happening, because cancer treatment is not the same. You go through different stages, right? There are times where you're not doing well, there are times where you're doing better, and then when you're doing better, new options are available, things that are less risky, less side effects because you're doing well. But however, if things get bad, you can't just stick to mild treatments. You might have to be a bit aggressive, and that always comes with its own risk. But there are ways that you manage that risk, and that's what talking, and understanding, talking to your physician. So if your onco most oncos are not trained to want to talk to you. So that's why I do recommend that you find a doctor like Dr. Jansen who will be able to answer your questions, help you understand, encourage you, and his team. I especially like Miss Beth, because many of my clients and patients who I refer to you, they tell me your healthcare specialists are very sweet and encouraging, right? So I think that's another thing as cancer patients, that we need someone that we don't feel afraid to talk to and ask questions. Questions are very important. I do think questions are very
that's
important.
the only way how we can learn, is by asking questions.
And I asked a lot of questions, so after that I changed my mind, right? I will take chemo if I am diagnosed with cancer, but it's unlikely. I take so much PPARs. All right.
Okay. I think this will be our last question. But first, I'd like to acknowledge our viewer, Miss Jeanette. Oh, hello. Thank you for watching. See you on Saturday.
Oh, wow.
I'm happy
Janet,
that
you're
watching
on.
right now. Yeah, see you on Saturday. Okay. All right, so for the last question that we have here, I think she came in late, a little bit late, but there are two people watching us who has the same question. How effective is the targeted therapy and oral chemo?
Wow, that's a good question.
Very quick.
Yeah, targeted therapy only selectively destroys the cancer cells. So that is how it works. Now, the difference between targeted therapy and chemotherapy is that chemotherapy is like a nuclear bomb.
Destroys everything.
Yes, so targeted therapy is like the word itself.
Cruise missile.
It's like a cruise missile. It's like a sniper. Okay, so it's very precise. It only destroys the cancer cell. Okay.
But Doc, the challenge, because again, this is another interesting story. I rented out my apartment in Singapore, and my tenant ended up being a chemotherapy researcher. He researches the chemo. I think that the challenge with targeted therapy is that cancer is a moving target.
Yes, it evolves.
So targeted therapy is very targeted, right? It's designed specifically for a type of cancer. So if the cancer mutates a little bit, the targeted therapy will not work anymore, or its efficacy will drop tremendously. So again, back to what you say, Doc. Cancer is a treatment. Sorry, cancer is a fight where you have to talk, you have to constantly monitor, because the enemy is also not sitting still. It's also moving. So your understanding about your approach, I think as a cancer patient, you should be dynamic. All right. Don't say, I'm going for chemotherapy, only chemotherapy, and that's the only thing I want to try. Or I'm only going for natural therapy, I'm not going to try anything else. Your disease is changing. You should be mentally prepared to also be dynamic and move along, finding the right options at the right stage, the right mutation for your condition. You might not be a good candidate for chemotherapy. Oh, this happened in Taiwan. Yeah. We had a client, right? Not patient. This is my counterparts, our Taiwanese distributors client, right? The client was so sick, so weak, couldn't go for chemotherapy. This is very strange. Opposite from many of our viewers, want to go for chemotherapy but cannot go for chemotherapy. Yeah. So was waiting to die, in a sense, because without the chemotherapy she didn't know what to do next.
Yeah.
Then someone shared with her the liquid PPARs. And you know what she did? She took 1 vial the first day, 2 vials the second day, 3 vials a day the third day. She ramped up until she drank like 7 or 8 vials per day.
Wow.
All right.
Wow.
Okay, I'm not advising anybody to do this. Again, this particular patient is a Hail Mary. What I mean is that she's come to the end of her road.
Yes, nothing.
She's
Yeah,
just willing to try anything, all right? So this is not our standard protocol, neither are we. I'm just sharing with you. So what happened was that 1 month later, she got strong enough to go for chemotherapy. See, I'm just saying, right? There is no like, your medical condition, your cancer is unique to you, your body's constitution. I think you really need to talk. And you really need to find a doctor who wants to ask you questions and understand your condition, because every patient is different, has different health, different constitution, and there are different options available to you, right? Even though on the surface the protocols may look the same. Take this. Everybody's taking tamoxifen for breast cancer, so it looks the same as if there's no differentiation, but that's not true. You know, slight changes in dosage, different advice, different timeline, not time frame in your doctor's mind. You know, he may want to give you high dosage now and then lower it later the moment you get better, right? As with Dr. Jansen's uncle. So you really don't know, because your patient probably didn't talk to her uncle. So she's probably like very surprised. Doc, I only need to do 6. No need to finish the rest of the 2, right? She didn't talk to her uncle enough, and I guess it's not in the nature of the uncle to say, this was my plan all along, right? I was going to see how well you react, and then if you did well, I will cut the dosage. But, you know, we don't have a habit of having conversations with our doctors. So we pretty much go in blind, like we are walking this road a bit blind, just doing whatever comes, right? So I hope tonight what an interesting conversation we have tonight. I hope that it encourages everybody and opens you up. The more you know, the more confident you will be, right?
Yes.
The more you talk about it, the less afraid you'll be about something. But do talk to the right people. Some people, the more you talk to them, the more scared you become, because they just tell you scary stuff and no solutions. Okay, so again, last question, so I'll go into my last words automatically.
Go ahead.
Okay. You know, I think this journey is a journey for me and Dr. Jansen as well, and I'm going to embark on a new journey next year. You know, I've been pretty involved in the research and study of PPARs, but next year I'm going to dive deep into traditional Chinese medicine. The reason is because many patients now try to go to China for more innovative or experimental or non-conventional approaches, you know, and I thought that to contribute a new perspective to this program that we do and better answer the viewers, you know, I need to learn a bit more in detail, right, about TCM, so that when I mix it with my current knowledge and I spar with my partner, Dr. Jansen over here, that you, the viewer, will be able to get more benefits. Because as we spar just now, I saw Dr. Jansen's eyes light up when I told him about in a Chinese prescription how we balance the drug. And then when I said I add ginger to my celery, he was like, all right. So it's not a matter of taste. It was not a matter of what nutrients. It was using a yin and yang concept, right? Which is totally very different from conventional medicine, but he could see the similarities or sort of understand the underlying principle that there needs to be a counterbalance to whatever active nutrients that are found in any protocol. So with this, I pray that our viewers, that you continue to embark on a journey, that you have better and better understanding of how you're going to fight cancer. I do encourage you to ask questions. I always tell people the answers to your problems in life are found in the questions that you ask. You ask the right question, you'll find the right answer, and then you will get the healing that you're looking for. So with that, I wish you all the best, and see you next week.
Thank you. Thank you, Sir Sean. Dr. Jansen?
Okay, mine will be shorter.
Okay, I'm long-winded, all right.
Yeah, so everyone, I just want to thank all of you for staying with us until this late in the night. I hope you guys learned a lot. And thank you for asking all of those questions, because by asking those questions, it's not just you who learn. Other people learn as well from the questions that you ask. So keep asking them. Now, I want to ask you a question. Have you clicked that like and the subscribe button yet? If you haven't, please click. Okay?
Yes,
and follow us.
And please support us on YouTube as well, right? Yeah, even though your usual Facebook. Okay, I saw one last question. I have to answer this. It's from Miss Geneva, right? I'm cancer survivor of endometrial cancer, stage 3B. Wow, praise God for that. Done with 6 chemo, 28 radiation. And 3 brachytherapy.
This is the standard, yes. This is
okay, that's tough.
Yes.
Do I still need your product? The answer is yes, because you need to keep. I don't know how long ago was your remission, right? I don't know whether it's 2 years, 1 year, 5 years, 10 years. Okay, but regardless, the basic concept is still the same. You are a cancer survivor. That means there were reasons why you got cancer in the first place. That should be sufficient reason for you to put extra focus to keep yourself extra healthy, right? So supplementation is definitely something I think is very necessary in the modern world, unless you live in a mountain with clean air. As long as you're living in any city, especially in Asia, the food that we eat, no matter where we get it, whether we cook at home or not, is just not ideal. We do need certain amount of supplementation, and when it comes to supplementation, I think there's nothing better than what we have as a foundation. If the supplements that we're giving now is good for fighting cancer, imagine you taking it to maintain your health and prevent cancer. Again, I'm not just sharing here. I've been taking PPARs for the last 20 years. I started taking it when I was 27. I'm now 48 years old. So I've been taking PPARs for 21 years. So one of the side benefits is anti-aging. As you can see, I look like Dr. Jansen's brother, but actually I'm old enough to be his uncle. So,
that's true.
all right. So this is to keep our general health. So for Miss Geneva, yes, I would say that you will still need the product unless you're really, really living such a disciplined life. If you are, then there's a possibility that you don't need further supplementation. But if you're like the rest of us, I think you probably will do better with some supplementation.
Thank you, Uncle Sean.
Go for a consult.
Uncle Sean. Go for a consult.
Go for a consult so I can give you the proper protocol. Okay, and see. Okay?
All right. Thank you once again, everyone, for your questions and for watching us tonight. Thank you, Doc Jansen and Sir Sean, for those wonderful questions. I must say, our two gentlemen tonight really love our viewers. We are now at 9:12 and you're still staying with us. Thank you so much. Just before we say goodbye, I just want to remind everybody, just before the next week, Thursday, another cancer webinar, we'll be having what we call the Doctor's Forum this coming Monday. This is the best venue for your doctors to understand how PFAS really works on you, on your body. All right? So make them register or have them register for this event this coming Monday, November 7th for the Doctor's Forum. And coming this next Thursday, November 10, 7:30 as well, is our topic will be cancer survival from off chemo to off remission.
Wow, that means total victory over cancer.
Total victory, yes. Thank you so much once again, everybody, and we really hope to see you once again in our next webinar. It's to come here because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night, and God bless you all.